Services Manager here at AgeSmart. I am also a Senior Health Insurance Program Coordinator and Counselor and have been for the last 18 years. But we decided to do something different for this. Sorry, I didn't pause. I just started. We decided to do something different, and we brought one of the ship staff down from Springfield. We have with us today Christian Fletcher. Christian has been with SHIP for 8 years now, and he is a trainer, and he is one of the people that the SHIP counselors call when we need help. So, Christian, I'll let you have it.
All right. Well, good morning, everybody. Like I said, my name is Christian Fletcher. I do work out of the state SHIP office in Springfield. We go around training all our SHIP counselors throughout the state so they can help you guys more one-on-one. What we're going to kind of do today is just some basics of Medicare. More people that are new to Medicare, getting ready to turn 65, maybe you're working still or just retiring. We'll kind of go over all that. Basically just kind of do the basics of Medicare so you can get an idea of what to expect kind of coming up. Before I get into it, I'm going to show you a few things. This Medicare choices that you got, this is basically going to kind of go along with our PowerPoint here. But this has got a lot of great information in it. My coworker Kim actually worked on putting this together. Basically what we've tried to do is kind of take that Medicare and You that you get every year and kind of make it a little more understandable. Kind of focus on things like that. Make it a little more understandable. In the back of it, there's a place where you can write some notes, but there's also a place, just a little checklist for open enrollment time. You can kind of look through there, answer those questions, help you a little bit decide on what you need to do. So there's a lot of stuff in there. Take a look through that at your leisure as we get done with today. The other thing, and this is a big one, and I think you might have two different things for this. Social Security is getting harder and harder to get a hold of. It can be next to impossible sometimes, it seems. So they have given us this on how to contact Social Security and get that appointment. There's numbers you can call. You can actually do the little QR code there and set up and get an appointment set up. So we wanted to get this to you because we know how difficult it is to get those appointments with Social Security, and this will kind of help you, get through that process, get that appointment. And then the last thing from me, and we'll wait till the end, but they wanted to make sure we're keeping track of all that we're doing now with the feds and make sure we keep getting our grant money in that. So this is just a little evaluation. So at the end, if you could complete this and you could just leave it on your table at the end, I would really appreciate that because we keep track of these and get them to the feds to show that we are doing what we say we are out helping people. All right, so let's go ahead and jump in. Oh, and before I get into it too, feel free as we go through, because I know a lot of times when somebody speaks, they'll say, wait till the end to ask questions. Well, after an hour and a half or so, you might have had a question in the first 5 minutes, and by that time you've forgotten. So I don't have any problems if you have a question. If there's something I say that doesn't make sense or you need a little more understanding, raise your hand. We'll try and answer it, as we go through. Sometimes I might say, well, hang on a second, the next couple slides, when we get into that, we'll get to it. But feel free, if you have a question, feel free to ask it as we go through. All right. So, just a little bit about us, what we are as SHIP. We were established in 1988. Basically, what we are is a free Medicare counseling program. We're there to help those that are coming on to Medicare, help them get what they need, get the coverages they need, get the information that they need. We are sponsored through State of Illinois Department on Aging, where we work out of. The key with a SHIP counselor versus possibly like an insurance broker you might go to and talk with is we don't sell or solicit any insurance. We're not going to point you towards a specific insurance. We're not going to say, this is the best for you, you need to take this. No, what we're going to do is we're going to tell you your options, give you those options, any way you can go, give you those options, all the information that we can so that you can make the best decision for yourself. A lot of those insurance brokers are going to try and get you towards their plan sometimes, and those aren't necessarily always the best for you. They're getting commission. We don't get any commission. We are just here to give you the information so you can make that best decision for yourself. Like I said, we train volunteers throughout the state. We do presentations like this all the time. Individual SHIP sites do individual counseling, so you can speak with a SHIP counselor one-on-one, go over anything you might need, any answers you need things to, and they can actually help you enroll as well, these SHIP counselors. So like during open enrollment time, that's one of our busiest times a year, where anybody can change plans, and we'll talk about that as we get going. But they can help you enroll. So if you find a plan you like, they can get you enrolled in it as well. All right. So now we're going to get into kind of understanding Medicare and what we're really going to go through today. So some of the things we're going to talk about. When can you enroll in Medicare? There's only certain times. They have enrollment periods, and we'll go over those some. When can you make changes? What is original Medicare? What are the parts of Medicare? Sometimes it's hard to understand. There's different parts of Medicare that cover different things. There's Medicare supplement plans that can help supplement your Medicare, so help with the costs. Medicare Part D is your drug plan. We'll talk about that a little bit. And then the Advantage plans we'll get to as well, and those are the ones you probably hear a lot of commercials on. A lot of commercials on those. So we'll get into those as well. All right. So to start out, what are the basics of Medicare? Well, Medicare has 4 parts. You have your Part A, which is your hospital insurance. We kind of consider that more inpatient. Anything that kind of ties around the inpatient with the hospital is going to be covered by Part A. Part B, they call your medical insurance. Kind of think of it as your doctor's insurance. It's your basic, you go to the doctor, Part A to cover that. Part A and B was original Medicare. When Medicare originally came out, it was just Parts A and B. So that's why we call that original Medicare. As the years went, I believe it was 2006, they came in with Part D drug coverage. They finally started to realize, bless you. They finally started to realize that, people take medications. Those medications are expensive. They need some insurance to help along with that. So they came out with Part D to help with your prescription drug coverage. And then there's also Part C, which is your Medicare Advantage plans. And we'll talk about that, but that's where they kind of bring in all the parts of Medicare. So they have the parts A and B, and usually drug coverage all kind of into one plan. So the Advantage plan's kind of that, I don't know, they what is it, Nationwide or whatever, they talk about bundling. State Farm talks about bundling. That's kind of what Medicare Advantage is. It kind of bundles all those together. So, who's eligible? That's the first thing. How are you eligible for Medicare? Who is eligible? Well, anybody that's 65 years or older, or those that are deemed disabled by Social Security, they're eligible after 24 months of being on disability. Or if somebody has end-stage renal disease or ALS, that Lou Gehrig's disease, they kind of automatically get put on to Medicare once they're deemed disabled. Once it goes through disability, if they have end-stage renal disease, they're automatic. The other thing, the person has to either be a U.S. citizen or they can be a legal resident. So if they're on that permanent resident card and they've lived here 5 continuous years or more, they're eligible for Medicare as well. So that's the other thing. Some people think, and you hear it in the news sometimes, that, all these illegals are getting Medicare. That's not true. They have to be here, permanent residents, and live here 5 years continuously before they're even eligible to get Medicare. So, and by 5 years continuously, that means they can't live here 6 months, go back to their home country for 6 months, come here for 6 months. It's permanent residence for 5 continuous years. Some people are going to automatically get enrolled into Medicare. And generally it's those that maybe they retired early and start taking Social Security at 62 years old. Basically it's those that are already receiving Social Security benefits or those Railroad Retirement Board benefits. And the reason why they're automatically enrolled is they're on Social Security's radar. they know, hey, they're already collecting Social Security. They know when you're going to turn 65, so they automatically enroll you into Medicare. What they'll do is they'll send out that initial enrollment package to you, usually about 3 months before your 65th birthday month. And then it'll have your Medicare card, everything there right with it. So if you're already collecting Social Security, be on the lookout 3 months before you turn 65. You should be getting your initial enrollment package within that time. What they'll do is you'll get your whole enrollment package and you're going to get your card in the mail with it. And that card's going to show you've got A, you've got Part B. There is, and we'll get to it here in just a little bit, there is sometimes when somebody might want to not accept Part B at the time, they might want to defer Part B. Possibly they're still working and still might be on an employer plan or something like that. So there's certain times when somebody might want to defer that Part B. If so, and they've been auto-enrolled, on the back of this card, you just sign, I don't want Part B at this time, send the card back to them, and they'll send you a card with just Part A on it. So we'll kind of get into why, I think in this next one, why somebody might, okay, and we'll get to it here in a second, but there's certain times when somebody might want to defer that Part B. If you're not collecting Social Security currently and you're getting ready to turn 65, then you will have to apply for Medicare through Social Security. And that it's fairly easy. You can do it online through SSA.gov. You can actually set up an account. I believe it's a My SSA account. You can do that at any time. Like I've already set one up myself just from working this job and talking about doing it. But if you set up a My SSA account, it'll show all your income that you've got, if there's any payments, what your payments are going to be. It's kind of your Social Security account. So that's kind of nice to have. And if you're not automatically enrolled into Medicare because you're not collecting Social Security yet, you can apply for Medicare through that Social Security website. All right. We talked about there's only certain times you can make changes or enroll in Medicare. Beneficiary can't always sign up when they want to. They have to make sure it's within a certain time period, certain enrollment period to be able to sign up. So we'll kind of go through those and what we've got. The first one is the big one. It's the initial enrollment period. And through us training ship counselors, and that's the first thing we always tell them, probably every ship counselor here remembers this, it's the 313 rule. 313 rule for your initial enrollment period. What that is you can sign up for Medicare 3 months before you turn 65, so 3 months before your birthday month, the month of your birthday, and then the 3 months after. So it's kind of a 7-month period that they give you to initially enroll into Medicare if you're not automatically enrolled. So it's kind of nice. If you sign up in those first 3 months before your birthday, it's going to take effect right on your 65th birthday, right on that birthday month. If you sign up, say, the month of your 65th birthday or any 3 months after, it's just going to start the month following you sign up. So it's better if you can sign up in these first 3 months because then it'll take effect right when you turn 65. All right, and this is where we're talking about possibly deferring Part B. Well, what if you are still working? You turn 65, you're eligible for Medicare, but what if I'm still working under an employee group health plan? Well, you can defer Part B then. In a situation possibly if your employer is a larger employer, they have more than 20 employees, you can defer that Part B if you want to. Because what they'll say is that employer plan is creditable for Medicare, so you can keep your employer plan until you retire, and then once you do retire, you get a special enrollment period to get into Medicare. So if your employer has over 20 employees and you're 65 or older, you can defer that Part B if you're still working. If the individual is disabled, they do jump that employee limit up to 100. And it kind of makes sense. A disabled person, probably has more costs, more medical costs due to the disability and going to the doctor and things like that. And it's just harder on a smaller employer. It could really be expensive for them. So they just up it to 100 because then it opens that pool up a little bit more for them. There's a little more money for them. So again, if you work, if you're still working, you turn 65, become eligible for Medicare, you can defer that Part B if you are still working and your employer has over 20 employees. So you'll see that a lot, and once you do retire, you'll get that special enrollment period to get into Medicare. A lot of times what will happen is because Part A will be free for a lot of people if you've worked 40 quarters. So what they'll do is that they'll turn 65, Part A is free, you might as well take it, and then you can still defer Part B since your employer plan will be covering that pretty much. All right, so the next enrollment period is the general enrollment period. So let's say you missed your initial enrollment period for some reason. You didn't sign up during that initial enrollment period. Now you're going to have to wait until the general enrollment period to sign up. So that lasts from January 1st through March 31st of each year. So if you didn't sign up for Parts A and B during your initial enrollment period, it kind of gives you a second chance at it. You can do it during the general enrollment period. If you enroll, say in January during that general enrollment period, it's going to take effect the 1st of February. So it's always going to take effect the 1st of the next month. The catch with the general enrollment period, you could get a late penalty depending on how long it was from the time your initial enrollment period was until you sign up during the general enrollment period. So just know there is late enrollment penalties with Medicare. We'll kind of talk about that here in a little bit. But that's why it's very important to try to get signed up in the Medicare during your initial enrollment period, and then you don't have to worry about possibilities of a late enrollment period. But if you do miss your initial enrollment period, you can sign up during this general enrollment period. Now there's some special enrollment periods, and they kind of opened these up in the last few years, after COVID actually, and they kind of opened things up a little bit. It used to be really for Parts A and B, kind of your main special enrollment period was that somebody that had active employer health coverage. They deferred Part B. So they had that active employer health coverage, they retire, they get a special enrollment period to then sign up into Medicare. Some of these others that they've added, individuals impacted by an emergency or disaster. So like all the flooding, say, that's going on in the Northeast now, if somebody was in their initial enrollment period during all this flooding for whatever reason couldn't get to somewhere to get enrolled into Medicare, they can actually use that if their state was under a national emergency or a federal emergency. They could use that as a reason to have a special enrollment period. If they missed their initial enrollment period due to that disaster, that emergency. If the health plan or employer gives incorrect information, let's say you're still working and your employer says, yeah, our insurance is credible, you don't need to get Part B, you can defer Part B. And then come to find out, well, they told you the incorrect thing, and you're out of your initial enrollment period. Well, if they did that, they're going to give you a special enrollment period because you were given incorrect information. So it's not your fault you're getting that incorrect information. They give you that special enrollment period. Formerly incarcerated individuals, those are individuals, once they are incarcerated, even if they're on Medicare goes away. They're under the jail system health insurance. So once they get out, they used to have to wait until the general enrollment period to sign up for Medicare. Well, with this now, once they do get out of prison, out of jail, they can, with this special enrollment period, sign up for Medicare right off the bat. And this was really started after the end of COVID, because people at the time, if they were on Medicare, they were just getting rolled over during COVID. They really weren't doing any redetermination to see if they were eligible or not. They were just rolling them over. Well, COVID ended, and so people started getting terminated from Medicaid once they started seeing incomes and getting the new incomes in. So if that were to happen, they gave them a special enrollment period. And there is other exceptional things. Basically what we have said is if you think you have a reason why you didn't, a good reason that you can explain to somebody why you didn't sign up when you should have, give it a shot. All they can say is no, But give it a shot. A lot of times you can plead your case, of why you need that special enrollment period. It's all done through Social Security, so you can talk to your Social Security rep and say, hey, this is what happened to me, and a lot of times They might approve that if you complete your case well enough. All right, so those first three are kind of more for Parts A and B, that original Medicare, to get into original Medicare. The annual open enrollment period is kind of like what it says, an open enrollment period. This happens every year from October 15th through December 7th. At this time, you can switch from original Medicare and get into a Medicare Advantage plan, or maybe you were in a Medicare Advantage plan and you want to switch back to a Part D plan. So this is a time you can kind of check everything. Maybe you're in an Advantage plan and lo and behold you get your annual notice of change or whatever, and your doctor's not in the network for that Advantage plan anymore. So it gives you that opportunity then during open enrollment to switch to a new plan. So this is kind of the big time year, and we tell everybody, look at your annual notice of change you get from the insurance company. See if anything's changed. Come see us every open enrollment so we can look and make sure that you're in the best plan you're in. Last year we found there was one plan, do you remember, Chris? It was like a $8 plan, and then it jumped to like $80 for the premium. I don't remember which, it might have been more.
It was more northern.
Yeah.
It wasn't down here.
Yeah. But they had a plan, the premium was $8, a Part D plan. Well, the company sent out the annual notice of change showing their premium was going to jump to $80, but a lot of people didn't read their notice to see that, and then January 1 came and their premium jumped to $80, and they're like, well, what happened? So that's why we tell you every open enrollment, look at those things you get from your insurance company, check them, make sure everything's still working okay, and come see one of us. We can go over things with you and see if it is still your best plan, still your best option, or look to see if there's another one that might be better. Any changes you make during this period is going to take effect January 1st. So any change you make during that open enrollment period is going to take effect the first of the next year. So the main one, we see is you want to join, switch, or drop a Medicare Part D plan. Maybe you've got a Part D plan, you want to get into an Advantage plan, or you have an Advantage plan and want to get back to Part D. Just different times you can change that. Well, we talked originally, initial enrollment period is also for Part D. You get in your initial enrollment period, you get into Parts A and B. Well, you also need a drug coverage or, possibly an Advantage plan. You can also sign up for those during the initial enrollment period. Like we said, the open enrollment period is kind of the main time. Every year you can switch, any plan you have, whether it's the Part D or Advantage plan. We talked about the special enrollment periods, certain times that they give you the option to enroll or change plans for special circumstances. And then this is a big one, this Medicare Advantage open enrollment period, and it's fairly new. I think it's only about 3 years now that they've had this. But what this has done for us is, say you're in a Medicare Advantage plan and you didn't check your annual notice of change to see if anything was different, and comes January 1st, you go to your doctor and your doctor's out of the network. You're like, oh, what am I going to do? My doctor's out of the network. Well, what they've done is they've opened this Medicare Advantage open enrollment period to kind of catch that. So that if you have an Advantage plan, something's changing, it's not working for you, they give you that out kind of the first 3 months a year during this Medicare Advantage open enrollment period where you can switch out of that plan and get into something else. Where this comes in big is a lot of times, these insurance companies might call you on the phone, or you'll see the commercials for Advantage plans. And, somebody will call you on the phone and say, hey, this Advantage plan does really work for you, what have you. Somehow they get you enrolled into it. We have people come to us every year like, well, I don't know how I got enrolled into that Advantage plan. Somebody must have done it. Well, this kind of gives you an out. If that was happening, you didn't want that Advantage plan, or your Advantage plan is changing, not working for you, kind of gives you an out. They give you a special enrollment period or a Medicare Advantage open enrollment period so you can make any changes you might need to.
What does the PD stand for? MAPD?
Medicare Advantage prescription drug.
Okay, that's what I thought.
Yeah.
Okay.
There is some Medicare Advantages that don't have prescription drug coverage, and usually people that get those might have VA, where they get their drugs from the VA, so they don't need other drug coverage. But generally, most of the Medicare Advantage plans, excuse me, we deal with do have prescription drug coverage included. All right, so I just talked about, why should you check your current plan each year during annual open enrollment? Well, there's a lot of good reasons. Sometimes they change their formularies for their drugs. 1 year maybe this drug's covered for you. Maybe they change their formulary and drop that drug off. Or maybe they put your prescription, your drug on a higher tier for the new year. So you really want to check that out and make sure the costs are still the same. So really check out those notices that the insurance company sends you right before open enrollment time, and see what changes they might have. See what drugs might not be covered. Maybe you've gotten a new prescription. You want to see if it's going to be covered, things like that. See what's not covered. The big one now that we're hitting is the weight loss drugs. They won't necessarily cover them for weight loss, but those weight loss drugs also help with, getting for diabetics or pre-diabetics to get their numbers down. If that's what the doctor prescribes it for, they're probably going to cover it. But if it's for weight loss, at this point, they might not. So sometimes you got to kind of see how that is and what your plan will cover. If there's any changes to that plan, if the premium's gone up, things like that. Maybe and this happened last year in Springfield area, one plan we had, Walgreens was their main place you could get your prescriptions at. It was their in-network preferred place was Walgreens. Well, they changed it to CVS. Well, that's something, if they would have checked their annual notice of change in February, they would have seen that Walgreens isn't preferred anymore. I'm going to pay more if I go there. CVS is now the new preferred. So it's just a big one. Just make sure you're checking those things you get from your insurance company to make sure nothing's changed that's going to adversely affect you. And if you see something, then you come in, make an appointment with one of these ship counselors. They can go over it and make sure they're giving you what you need. All right, so that's kind of how you get enrolled into Medicare, what the four parts of Medicare are. Now we're going to kind of dig a little deeper into what each part of Medicare actually is and covers and what those costs are associated with it. So, Part A, like I said, that's your hospital insurance. There's kind of your inpatient, kind of anything that goes along with inpatient. So it's your inpatient hospital care. Skilled nursing facility care that comes after an inpatient stay would be covered under Part A. Home health care, if it's after an inpatient stay, again, be covered by Part A. And then hospice care is covered by Part A. So that's why I kind of try to think of Part A as kind of your inpatient insurance. It has, it has to do with being inpatient in the hospital or anything coming out of that inpatient stay.
So I have a question.
Yes.
If you have long-term care insurance for a skilled facility, does that cover everything, or does Medicare pay for their portion first and then your long-term pays for the remainder?
Yeah, long-term care, Medicare doesn't pay anything towards, so it'd be all your long-term care insurance.
So then, so if you have long-term care insurance, you pay for everything through your insurance.
Yeah, through your long-term care. Yeah.
Lori, you would be, if you were doing rehab for long-term, Medicare would cover your first, the days that Medicare covers. Then after Medicare quits, then your long-term care insurance comes in.
Yeah.
Okay, but what if I'm not doing rehab? What if I'm just...
Then Medicare's not going to pay.
Okay.
Yeah.
Okay, thank you.
Yeah.
Thank
That's
you.
why having long-term insurance, long-term care insurance is a pretty good idea. It's just, Medicare
Can't
doesn't.
afford it.
All right, and like I said, Part A is generally, for most of us, if we've worked, they call it 40 quarters, it's roughly 10 years. If you've worked and paid into FICA, I know when I first started working, I got my check, and I was like, who's this FICA person? Why are they taking all my money? Well, FICA is the Social Security Trust Fund. That's what helps pay for Medicare. If you paid those 40 quarters, so if you worked 40 quarters, your Part A premium is nothing. Now, let's say you didn't work 40 quarters. You're still eligible for Medicare. That doesn't mean you're not eligible for Medicare. You're still eligible for Medicare. You might just have to pay a premium for that Part A. So if you work, say, 30 to 39 quarters, you work, a little bit, not quite 40 quarters, well, that premium for Part A is in $285. If you work less than 30 quarters, then that premium is $518. We don't see that as much because we usually see, people that have worked 40 quarters paid into it, so we don't see that a whole ton. But a lot of teachers didn't pay in, to fight. I started out as a teacher. They didn't take those Social Security out of our checks because we're technically under Teachers Retirement Board. Those teachers, unfortunately, once they become Medicare eligible, they might have to pay that Part A premium if they didn't, pay into Social Security. But the main thing is if you have over 40 quarters, it's going to be premium free for Part A. All right, this is kind of the Part A cost, and it looks scary, and it kind of is because this first one is a deductible, and it's $1,676. That, when you see that, I see it, I'm like, whoa, that's kind of scary. Well, that's if you had nothing else. So if you just had Medicare Parts A and B, the original Medicare that way, then yes, you're going to pay that $1,676 for a deductible if you go into the hospital for your first 60 days. Then after that, there's going to be a small daily amount that you'll have to pay. Most of this, if you have an Advantage plan, Advantage plans are kind of formatted a little different the way things are. But in Advantage plans, they kind of take that deductible and kind of spread it out. You have more co-pays that you have to pay. So you don't really ever see that deductible. There's also, and we'll get to this a little bit later, you can get a supplemental plan, which basically supplements Medicare. It takes that 20% that Medicare doesn't pay for that you'd be responsible for, and usually that supplemental will pay that. If you have a supplemental policy, generally they're going to pay this deductible as well for Part A. So that deductible is there. It's kind of scary looking, but like I said, once you get your full Medicare coverage, usually you don't see that as much. It's kind of covered within all the insurance. All right, so Part B. All right, so we talked about Part A. It's your inpatient, kind of anything to do with inpatient. Part B is your doctors. Now, Part B does have a deductible, which is $257. Again, depending on if you have an Advantage plan, things might be a little different, but how that's taken. But the annual deductible is $257 in 2025. That does go up every year. I believe it was like $240 last year. It's gone up. It pretty much goes up every year. Part B, co-pays or co-insurance. Well, generally Medicare is going to pay 80%. And then you'll be responsible for 20%. So that's usually how it works with Part B. There is some things where they'll give a copay. I always use, say you broke your leg, you have a cast on your leg, you have to go get your cast taken off. Rather than paying 20% for that, they might have a $20 copay or something. There's certain things they might do copays. But generally speaking, Part B, Medicare will pay 80%, and you're responsible for 20%. There is a Part B monthly premium. It's $185. That does change yearly. It actually went down 2 or 3 years ago, but then it goes back up. So it usually goes up every year, but that's something you can check on. Everybody really pays that Part B premium unless you might be lower income and are eligible for Medicaid or the Medicare Savings Program to help pay for that. But most people are going to pay that Part B premium. Like I said, most things after that deductible is paid is going to be 80-20 with Part B. You'd be responsible for 20%. There is some things where they might have a copayment. Like I said, if you just go in to get a cast taken off or something like that, they might have a set copayment for that. All right, so what's covered by Part B? Well, like I said, inpatient was Part A. Pretty much anything to do with inpatient was Part A. Part B is kind of your outpatient. It's your medical. It's your doctor. Things like that. So they're going to pay physician services, tests, physical, speech therapies, any therapies you might need. Your ambulance is paid through Part B. Medicare is going to pay that 80% after that deductible is met, and then you'll be responsible for 20% for most of those expenses, unless you have a supplementary advantage plan. Home health care. Let's say you go into the hospital and they don't always put you in as inpatient. They might have you as outpatient because they're not sure, what they call under observation. They're not sure what your diagnosis is. Well, you're an outpatient. You're in the hospital, but you're technically an outpatient. And the doctor says, well, they need home health care once they get out of the hospital. Well, if they're in as an inpatient, like I said, Part A is going to pay for that home health care. If they're in as an outpatient, say they're getting observation status, then Part B will pay for their home health care. But just so you know, regardless whether it's Part A or Part B, if they're in the hospital, and their doctor says they need home health care, part-time skilled care after they get out of the hospital, whether it's they're inpatient or outpatient, it's going to be paid by either Part A or Part B. But home health care is covered. Part B is going to do any outpatient hospital services. Like I said, those are outpatient surgery. They even do knee surgeries outpatient anymore. My son had an ACL surgery and it was outpatient. So they do a lot of things outpatient anymore. Emergency room, if you go to the emergency room, Part B is going to pay for that because you're not inpatient yet. You're going to the emergency room, kind of under observation. So they'll pay for that. And then any durable medical equipment. So that's your walkers, your wheelchairs. It even goes as much as, artificial limbs, pacemakers, things like that. Any of that durable medically necessary equipment that's needed is covered under Part B. All right, so we get a lot of people that say, $185 for a Part B premium is pretty steep because, then you got to think, well, you're probably going to have a Part D premium, you might have to pay as well. Well, is there anything that can help me pay that Part B premium? Because we say everybody has to pay that Part B premium, which is true. But sometimes we can get the state to help pay for that if your income's a little bit lower, if you're within those income guidelines. And the Medicare Savings Program is that program that we try to see if we can get people eligible for, because it'll help at least pay for that Part B premium. And if your income's even lower, it could possibly pay for all of your co-pays and co-insurance as well. So, to qualify for the Medicare Savings Program, you have to have income within the guideline. For 2025, your income would have to be less than $1,761 per month as an individual, or $2,380 as a couple to be eligible for Medicare Savings Program. And your resources or assets would have to be below these limits. But it's, if you think you might be close to that, I always say it's worth a shot to try and apply for it and see. It goes through Medicaid, so DHS is the one that does all this, and it finds if you're eligible or not. They tell us what all income that they can count, but sometimes it seems that there's something that we think they would count that they don't, or there's something that we think they're not going to count that they do count. So I always say that if you're anywhere kind of close to this number, if you think, give it a shot and apply. Like I said, the worst that can happen is they'll say, no, you're not eligible. But what if you are eligible? Then you save $185 a month. So it's worth a shot. To learn more about this, you can talk to any SHIP counselor, around the area that can help you with this, help you possibly get that application in. Or you can go straight to the AID. It's the DHS's way to sign up for Medicaid through the AID program. There's also all their other programs they do, so any food stamps, not food stamps, SNAP now, any of those other programs that they have, they would also check you for as well to see if you'd be eligible for that. So you can get all that information at their website there. All right, so here's just, we like our charts at SHIP. Our old worker Dave just retired a couple years ago, was big on the charts because visual learning, like to see it. So this kind of shows you just what those limits are for the program. There's 3 separate programs for this Medicare savings program that you can possibly get. The lowest income one, the QMB, this has the most stuff for it. It's going to pay your Part A, Part B premiums if you have a Part A premium. It'll help pay for that and your Part B premiums. And it's going to pay those deductibles in any co-insurance. So these people are usually the lowest income, probably Medicaid eligible. They're eligible basically for everything. They can get their Part A, B premiums paid for, deductibles, co-insurance. They go to the doctor, they're not going to have to pay anything. Then the income goes up just a little bit. So if you're 120% federal poverty level, they're going to pay your Part B premiums. And then it goes up a little bit more to 135% federal poverty level, and they're still going to pay their Part B premiums. I always ask, well, isn't it the same? They're paying the Part B premiums. Couldn't they just have one and leave it there? Well, come to find out, this qualified individual one is a certain pot of money, and it can run out. And so sometimes, that was the explanation, at least that I got of why there's 2 different ones. But so sometimes if you're that a little higher, you're the 135% federal poverty level, depending upon how much is in that, you could be eligible or think you possibly not be eligible. But I always say, if you think you're close to this, apply. It's always worth a shot. All right, so we kind of talked about original Medicare and said, Medicare is going to pay 80%. You're going to be responsible for 20%. And we saw that chart of fees with that $1,676 for that Part A deductible. It was pretty steep, and some other costs. Well, how do you fill those cost gaps in Medicare? What can you do to help fill those cost gaps so that, you can get the best coverage you need, hopefully at the cheapest prices? Well, you kind of have 2 routes that you can go. You can go the route where you're going to get your original Medicare, your Part A, your Part B. You're going to get that Medicare card in. You're going to get a standalone Part D plan for your prescription. And then you can get this Medicare supplemental policy. And a supplemental plan does just what it says. It supplements that Medicare. It's going to pay basically that 20% Medicare doesn't pay. Now, I will say those Medicare supplement premiums can be a little steeper, but it's kind of one of those things, you set it and forget it. You pay your premiums for a supplement, and the supplement's going to pay second to Medicare anywhere you go. You can use it anywhere in the country that takes Medicare. Put it that way. Your second choice is through an Advantage plan. And those of you that have worked and been under an employer plan, any more employer plans are pretty much kind of like an Advantage plan. It's those, where they pull everything together. Basically, what an Advantage plan is going to do is going to take the Part A benefits, those Part B benefits, and usually your Part D for your prescription drugs, and kind of put it all into one plan. It's formatted a little different the way costs are done. You pay co-pays and such like that. But I'll get into the specifics of it here in a second, but it's just another option that you have. All right, so we're going to get in first to Medicare supplements. So basically a supplemental policy is going to be a standard insurance policy that's sold by a private insurance company, but it's specifically designed to work only with Medicare and fill those major benefit gaps. So a Medicare supplemental policy isn't going to work with any other insurance. It's only going to work with Medicare. But that supplement's going to pay secondary to Medicare every time you go to the doctor that accepts Medicare. Medicare's going to pay their part, and then the supplement will pay their part. And you usually don't see it there. So like I said, it's a private health insurance for people that have both A and B. It is sold by private companies, and they're licensed through the Department of Insurance. They're all standardized, which is kind of nice. And if you look, you're right on that page. What page is that? 13. If you look on page 13 in that Medicare Choices, there's kind of a graph, a listing of each different plan. And you see that they're done by letters. You have Plan A, Plan B, Plan C. Well, what they've said is when they say they're standardized, each letter's the same, if you were to get that Plan A, it's going to have the same benefits no matter what company you go with. All right, they're going to cover the same things. Whatever it says, whatever's checked on there, it says 100% under that A, no matter what company you go with, their A is going to have to cover that as well. So that's kind of nice. They're all standardized in that way. So usually we'll say, well, let's look at cost, and see which one's the cheapest for you, see which insurance company you might know or be comfortable with, and see if they're lower in price. So it's more about, looking for the lower price for you. Those are all standardized. Now they have, in the past couple of years, added where they can put in some supplemental benefits, kind of like you hear Advantage plans. Some of those might have a couple little extras, possibly now. But the standard benefits between plans are going to be the same. So if it's a Plan A, the standard benefits are going to be the same from, Blue Cross Blue Shield to Humana. If it's a Plan G, same thing. Their standard benefits for that Plan G are going to be the same from company to company. Just the cost will be different. But these supplements are great because they're going to supplement only Medicare, but they're going to pay all those kind of gaps in the original Medicare, depending on which plan you choose. They're going to pay for those copays. They're going to pay for the deductibles, possibly. I'll tell you, my mother had colon cancer 4 years ago, because she's almost to her 5th year, so she gets to break that glass. But she had a supplemental plan. Colon cancer, to go in, it's expensive. The bills were, she was seeing, just because she could see the bills and see how much they were, it was expensive. She never had to worry about anything. The doctor billed her Medicare, they billed her supplemental plan, she never saw a bill. She just paid her supplemental premiums every month and didn't have to worry about it. So supplements are nice in that. Their premiums are a little steeper, so there are, can be a little pricey, but it's kind of that set it and forget it to some extent. Supplements supplement Medicare. Medicare pays, supplements going to pay. You aren't going to see a whole lot, of bills coming to you.
I have a question.
Yeah.
So I'm hearing now that some providers are not accepting Medicare. So if they're not accepting Medicare and you have a supplemental, would the supplemental won't take it either?
No. And I don't know if it's that they're not taking Medicare. A lot of times they're not taking Medicare Advantage plans. Mm-hmm. Most of them will take Medicare because Medicare is going to pay them. There's a few I'm sure that have dropped out, but most times they'll take Medicare because Medicare, they know they're going to get paid for Medicare. Medicare Advantage plans are a little different. And, because that's actually paid through that Advantage plan. And there's a lot of doctors and hospitals, especially the further south you get. Even in around Springfield, we're having issues with Springfield Clinic not accepting those Medicare Advantage plans. And I think that's probably more so what you'll run into. Now, to get a Medicare supplement, there is a strict enrollment period where you can get it with no underwriting at all. And that happens the first 6 months that you get your Part B. So once you enroll into Parts A and B, once that B becomes effective, you have 6 months to sign up for a Medicare supplemental policy, and they cannot underwrite you. That means they can't turn you down. It's your one shot at it where they're not going to turn you down. It begins when you're first enrolled in Part B, and it's going to last for those first 6 months. In Illinois, they have to. It's a guaranteed issue within that 6 months. They cannot turn you down. So, that's the time. If you're going to get into a supplement, those first 6 months on Part B is your best time to do it because you're not going to be underwritten. Now, let's say it's after that 6 months. Maybe you didn't get it within that 6 months. Can you still get a supplement? Yeah, you can get a supplement still. They just might underwrite you. And if they think you're a health risk, they could deny you. So that first 6 months after you're on Part B is the only time it is guaranteed. They cannot deny it. The good thing is, Illinois is kind of a great state in the sense that, you know, we help our people less fortunate in some way. You know, we help those less. Well, in Illinois, a disabled individual also has the same right to get a Medicare supplemental policy. Like I said, if a disabled individual, after they've been on disability for 24 months, basically 2 years, they become eligible for Medicare. Well, at that time, once they become eligible for Medicare and they get Part B, they could get a supplement as well. And they won't underwrite them in that first 6 months either. The great thing about these disabled individuals, they're under 65, they get their supplement. Once they turn 65, they get another bite at the apple, another 6 months, because now they're age eligible for a supplemental policy. So just remember that first 6 months is big, and those that are disabled actually get a second bite at the apple once they turn 65. But the main thing I want you to remember out of this is once you get Part B, you'll have 6 months where you can get into a supplement with no underwriting. They have to accept you.
Question?
Yeah.
What about someone who deferred Part B?
Excuse me?
What about someone who deferred Part
Yeah,
B?
if they deferred Part B, good question. If they deferred Part B, let's say you're working and you defer Part B, once you retire and get Part B, your 6 months would start then. Yeah, so that's great. This is our chart again, and it kind of shows you what each one pays for. As you see, they're all going to pay that, you know, co-insurance, inpatient hospital costs. If you have a supplement that's $1,676 deductible for Part A, you're not going to see. The supplement's going to pay for that. And then as you see, some of them start, you know, a little more. These that are in blue, this C, F, and it's a F high deductible is what they call it. Those actually did pay the Part B deductible. Well, a couple of years ago, the feds, for whatever reason, said, no, you know, everybody needs to pay this Part B deductible. So C, F, and FHD are still there, but you can only get those if you were 65 or Medicare eligible before January 1st, 2020. So those, if you were 65 or eligible for Medicare prior to that, you can still get a C, F, or this F high deductible. Yes?
If you had, like the FHD that you have, so you live in Illinois and that's where you've always had it. Now all of a sudden you're going to move by one of your children because you're, whatever. Can you transfer your same insurance that you've carried for ages with another insurance company, or can they say to you, you can't have that?
Well, you should be able to keep it, what you've got. Because
even though you would live in a different state?
Supplements work everywhere. Anywhere that's accepted by Medicare. That's what's kind of nice. They're not like, you know, Advantage plans you hear about, you have to be in the state, you have to be in your networks, what have you. Supplements aren't like that. You can take them anywhere. That's why we tell people, you know, if you're a snowbird, for example, you live here 6 months, you live in Florida 6 months, supplement sometimes is a good way to go because you're going to be covered. You know, as long as the doctor accepts Medicare, the supplement's going to pay their part. So yeah, if you have, say, the F and you move to Florida, you can keep it and it's still going to pay. So, yeah.
And it's expensive, but I have the same story that you have. My husband had cancer, and I had one, I don't know why, but $120 bill that I paid in 3.5 years.
Yes, my mom, same thing.
And
didn't make
when
sense.
I looked to change, before my husband was sick, he said, we paid for that when we were younger. Now that we're older, this is the time to change to something that will pay less because you're going to have more bills. So I don't know that was, but that was our decision.
Yeah, and like I said, we used to call that the Cadillac plan because it basically covers everything. Like you said, you didn't even see a bill, you know. So yeah, right now this G plan is kind of the new Cadillac because it pays everything that F does except for that Part B deductible. So G plan is kind of what we consider the new Cadillac plan. All right. So what do the policies cost? Well, they can get kind of expensive. They can vary depending on your age. Of course, if you're older getting into it, it might be a little more expensive. It does place of residence, so that depends on where you live. They do figure that out, which is kind of weird because it's covered everywhere. They take it everywhere, but they set your premium on where you're at. So down here, premium's probably going to be a little bit less than Chicago, which is kind of nice. It depends on the company selling the policy, of course. Each company sets their own prices. And then there is some discounts you can get. They give, women discounts. You tend to live longer than us men. If you're a non-smoker, they'll give you a discount. Married couples, they have household discounts that you can get for married couples. If you both get in the same plan, you might can get a household discount for that. So the cost can kind of vary depending on different things. So just you really want to check with the insurance company and see what their specific cost is. What's great is we actually have a tool now. It used to be this Medicare Choices book that I've given you guys. We used to do it. It was our Medicare Supplemental Premium Comparison Guide. And the State Department of Insurance used to give us, basically it was an estimate, so it was based on, I think, a 65-year-old male non-smoker in Chicago. So they based it on that, and we could get figures from all the companies in the state would give us those figures, so we could have kind of an estimate to give you on different companies. Well, they decided not to give us that information starting last year. So that's why we've come out with this Medicare Choices to kind of bring it all together for you so you can have that information. But what they did do is us SHIP counselors have access to a program in what's called the SHIP TA Center where we can actually go in and do a comparison for you and see what is out there, what plans are out there, and kind of help you, at least whittle it down between what plans might be, the best for you, and then you can call the plans to enroll in. So it's really nice. We can do customized searches. We can check, gender, age, tobacco status. If you want to check for household discounts, things like that, SHIP counselor can help with that. So if you're looking for an advantage or looking for a supplemental plan, make an appointment with your SHIP counselor. Maybe they can get on that SHIP TA Center and do a quote with you and see what you might have out there for you. All right, Part D we're going to go through now. And this is the prescription drug. This one's actually easier, Part D for drugs. All right, so Part D. It's covered, it's again, private companies, but these companies are contracted with Medicare to provide the prescription drug coverage. Part D is available to anyone that has Part A and or Part B. All right, there's two ways you can get drug coverage. You can get either through a standalone prescription drug plan, which is your Part D plan, that's your standalone prescription drug plan, or you can get it included with your Medicare Advantage plan. So two ways you can get that drug coverage. How are you eligible for Part D? Well, anybody that's entitled to Part A and or they have Part B, or they got both, and they live in the service area of the Part D plan. This is where it matters your area, because those plans are tied to an area. They're tied to certain, like Walgreens and CVS, certain places like that. So it is specific to your area. So if you have a Part D plan and you move to a different place, you'll get a special enrollment period to switch that Part D plan to one that works in that area. So just know Part D plans and the Advantage plans we'll get to are both kind of service area specific. Once you move out of that service area, then you get the option or the opportunity to switch plans into one that works in the new area you're at. Most of the time, these Part D plans are going to have a premium, monthly premium. There was one in the state last year that was a $0 premium that always kind of threw me off. But they all will have a premium, and they will have costs, to go along with their drugs. They'll have a list of what drugs they cover, called their formulary, and different things like that, so you can check all of that. All right, so Part D, there's different coverage phases on how they cover your Part D drug. There is a deductible period. And that's $590 was the maximum deductible for 2025. So a Part D plan could have a deductible as high as $590 if they would like. But they could also have a $0 deductible, or they could have a deductible anywhere in between $0 and $590. They just can't go above that $590. So that's something too when you're looking for a plan, you know. See if there's a deductible. You know, if you can't afford to pay the $590, you know, deductible out of pocket, see if there's a plan that doesn't have a deductible. Usually there's, you know, plenty of plans out there that might not have a deductible or have a lower deductible. So you can check on that. Next phase is your initial coverage period. This is when you're going to start, you know, paying for your prescriptions. The plan's going to pay roughly 75% of that covered prescription, and you'll be responsible for 25% of that cost. I will say there is plans who have special, you know, deals in that initial coverage phase where they might charge you less than 25%, or maybe generics will be free or something like that. But the max they can do is they'll pay 75%. The max you'll have to pay is 25%, you know, depending on how they have it set up. Then, this is great, they actually have an out-of-pocket limit that hit this year of $2,000. Last year was $8,000. That $2,000 out-of-pocket limit is huge, because that just, I mean, it's so much easier for people to you know, $2,000 versus $8,000. Once you hit that $2,000 mark in out-of-pocket costs, and this is all kind of figured behind the scenes, you know, through in the plan finder and through your thing of how things are calculated and what counts towards that $2,000. But once you hit that $2,000 out of pocket, you pay nothing. $0 copays for the rest of the year. So that's kind of nice. So we're seeing a lot of people, I think it's Humira is one that's really expensive prescription. They might hit that $2,000 in the first month, and then the rest of the year they pay nothing. So that was one great thing that came out of the Inflation Reduction Act, was to drop that. We did get some initial stuff about next year, and it looks like they're only going to raise this to $2,100, which is great. It surprised me just a little bit, but that's awesome. So that's great. So once you hit $2,000 in out-of-pocket Part D costs, $0 copays the rest of the year. So just as an example, how does this work? Well, Mrs. Smith goes into to get her prescription. She's going to pay an amount out of pocket up to possibly that $590 deductible. You know, it could be less, but it can't be more than $590. Once she passes that deductible phase, then she goes into that initial coverage phase. She's going to pay roughly 25% for her prescriptions until she reaches the $2,000 out-of-pocket mark. Once she hits that $2,000 out-of-pocket mark, there's going to be no more out-of-pocket costs for covered drugs for the rest of the year. So that's kind of good. So that this year has really been good, you know, lowering those costs. They also this year, because of the high cost of prescriptions and you know, it gets hard to pay for them, they started this Medicare prescription payment plan. So basically what it is for those that have high costs early in the year, you know, higher cost drugs, they're going to hit that $2,000 fairly early. What this does is it allows them to spread those payments out over the whole year. So they can, you know, $2,000 maximum that they're going to have to pay, well, they can spread that out over the whole year. So they're not hit with $2,000 all in one month. So that's kind of nice. You're not hit with that big cost right off the bat. Basically what they do is they're going to pay that monthly, whatever that monthly payment was, to their plan. And then when you go to the pharmacy, you're not going to pay anything because you're paying your plan for that. So it's just a way, if you have really high drug costs, you know you're going to hit that $2,000 early, you know, it's a way to spread those costs out, which is kind of nice. There's a program called Extra Help that helps pay for Part D, you know, these prescription drugs for lower income individuals. It's really not, the payment plan is not good for them because they really wouldn't benefit anything from it because Extra Help is helping pay. But generally, if you know you have higher cost drugs, you're going to hit that $2,000 early, you can do this payment plan, spread it out over the whole year. How are they going to calculate it? Well, this is just pretty simple, how you would think. Divide it by 12, 2,000 by 12, you get 166. Well, that's kind of how it figures. They actually have a more in-depth thing how they figure it, so monthly payments could be a little bit different with the way they figure it, but roughly, you're going to pay no more than $2,000 no matter what. And if you want to participate in this, you just contact your health or drug plan and let them know you'd like to do the prescription payment plan. They can get set up. All right, Extra Help, I kind of touched on just a second ago, but this is a great one. It's a program from Social Security. It helps you pay for those Part D prescription drug costs. They can be very expensive. For a single person, it's 150% federal poverty level, I believe. I think is it, and it's $1,957. So if you're around that or below that, it's something good to apply for. Because what it does is it not only will lower your premiums, but it's going to lower your costs for your prescription. Paying no more than $12.15 for a brand name or $4.90 for a generic. So Extra Help, what it's going to do is help lower those costs for you, so it makes it a little more manageable. There is some, benchmark plan, they call it, is an Extra Help benchmark plan. Last year we had one. So would have been a $0 premium, and these, cost when you go to the pharmacy. But what they've done is those that aren't technically benchmark plans, you still get them. You still get these lower costs at the pharmacy, and usually what they'll do is the premium is adjusted lower, depending on each plan. So if the plan is what they call enhanced, has special things, well, you might have to pay the premium for that enhanced part, but then, it'll be less for the other. So Extra Help is a great program to get into if you have high prescription drug costs. And then again, here's the chart showing those limits. It always throws people because when you look at this one, the 100% federal poverty level, well, the resource limit is $17,500. Well, then as you go down this way, it drops, and then it comes back up. It never did make a whole lot of sense, except that this number here is Medicaid's number. Their resource limits for full Medicaid, they upped them to this. It used to be $2,000 and $3,000. So that's why that's higher for that one, and then these just grow as the income grows. But as you see, if you get in a benchmark plan on any of these, any level you are, if you're in that benchmark plan, you pay $0 premium, 0 deductible, and then you're going to have the lower co-pays for your prescription. So Extra Help, if you can be eligible for it, great program to help cover those prescription drug costs. So what are some things you kind of want to think about when you're thinking about your prescription drug plan? What do you want to look for your coverage options? Well, check the plan's formulary. Basically, a drug plan's formulary is just a menu of the drugs they cover. That's what it's going to be. Check that formulary. Make sure all your drugs are on that formulary and are covered. Because if a drug isn't covered, that's not going to count towards your $2,000 out of pocket. That's just out of your pocket. That $2,000 is for any covered prescription. So make sure all your prescriptions are on that formulary. Check the plan costs. What's the monthly premium? Is the deductible high? Do I want a deductible? Do I not want a deductible? What are the co-pays for those drugs? There's a plan finder that you can anybody can get into, or you can come and have one of the ship counselors help you with it. But you can put in that plan finder all your prescriptions, everything you take, and it'll search what plans are out there that'll be cheapest for you that covers those prescriptions. So make sure, you want to make sure all your drugs are covered. See if there's any advanced coverage. Some of them have $0 for generics. I know my dad's on one, and he didn't take anything but a blood pressure medicine, and it's a generic. He pays $0 for that. So some of them have that benefit where they might have a lower deductible, $0 generics, lower percentage for certain prescriptions. So check into that. There is some things with prior authorization where they'll say, you know, a doctor prescribes it to you. Well, then they'll go back and make the doctor, I guess, give a reason why you need that prescription. Kind of prior authorization to get that prescription. You have to be authorized by that insurance company to get it. Those things they'll tell you when you get the plan. If there's any quantity limits, most of those are like opioids. You know, they'll cut the quantity limits now to about 7 days versus a full month, just because trying to keep people out of, you know, getting addicted to them. So some might have quantity limits, or some might have what's called step therapy, where the plan might say, well, we want you to try the generic first. If the generic doesn't work, then you can go to the brand name. But with step therapy, we just want you to try the lesser expensive drug first. How that works. And then you want to check their star ratings. And this plan finder, when you search for the plans, they'll have star ratings. And those star ratings will tell you how good they're doing, you know, how good their customer service is, how good their payments are, you know, what have you. All these things, I think there's 37 different criteria that go into these star ratings, and they'll put them in there so you have an idea of, you know, how well that company is. What is their star rating? Has their star ratings been dropping, you know? Are they a 4 or 5 star? So, you know, take a look at that, because that can be somewhat important, you know. I would say that just because, say, a company has 3 stars, that's not necessarily a reason not to take them. It's possible they just, you know, had some bad billing one quarter or something and it kicked them there, down to 3. Once you get below 3 stars, then I might start getting a little bit leery, you know. But again, if the cost fits and it's the cheapest plan for you, you know, sometimes it's worth the risk to try. But those star ratings are at least out there to help you kind of see what would be, you know, how they're.
Who sets the star ratings?
That's by the feds. Yeah, they get information from all the companies. I mean, there's 37 different criteria. If I remember right, put it all together. Kind of like the Better Business Bureau will work for that.
And how do you find the plan finder?
Oh, Medicare.gov.
Okay, it's on
Yeah,
there.
yeah. Medicare.gov, and it'll pop right up there, and you can get into plan plan. And you can mess around with anything in that plan plan. That's what we always tell our counselors when we're training them. Get in there, mess around, throw a few, you know, different drugs in there that you might not know or you think you take or whatever. You know, just, you can kind of mess around and see. As long as you don't hit enroll, no worries. Right. All right, so now we're up to Medicare Advantage plans. So we just kind of went over original Medicare. If you were to get original Medicare's A and B, you have to get a Part D plan for your drugs, and then you might want to get that supplemental plan to help cover that 20%, the extra. Well, your other option that we said was to go with a Medicare Advantage plan. Basically what it is going to do is going to take A, it's going to take B, and it's going to take your Part D and kind of put them all together into one plan. You're still technically in Medicare, but all your insurance, all your things are going through this Advantage plan. They have a different delivery and cost structure. There's co-pays. You know, every time you go to the doctor, there's different things, the way they do it to offset their costs. Some, and this is what a lot of people get into Advantage plans for, because they have some additional benefits. You know, Medicare, unfortunately, doesn't pay for hearing, vision, and dental, which seems totally backward to me, because what's the first thing that goes when you get older? Eyes, ears, and, you know. Anyway, so, yeah, I mean, I'm hating it now. I need new glasses because just in the last 3 months, I can't see close anymore, you know. But yeah, so they don't cost that. So some of these Advantage plans have some of these additional benefits that you can look into. Some have hearing, some have vision. Dental, the big one we always hear about is the silver sneakers. Everybody loves that silver sneakers, you know. So they might have some extras, just so you know. But basically that managed care plan, they call it a managed care plan. Your Advantage plan is going to handle the coverage for anything that you have. You'll use their benefit card when you go to the doctor. You know, you're using that card when you go to the doctor versus your Medicare card, because you're actually in that plan. All right, so how are you eligible? What does it cost? Well, you have to have A and B. We said with Part D, it was you had to have A and or B. So either one, as long as you had one of them, you could get a Part D plan. With an Advantage plan, you have to have both Parts A and B. And the reason is because the Advantage plan is taking those two together. It's putting those two all into one plan. You're still going to pay that $185 or Part B monthly premium like everybody pays. Can't get out of that, even unfortunately state retirees. My dad's a state retiree. Got state retiree insurance, still has to pay that $185. Some plans might charge an additional monthly premium. Some plans don't. That's the other kind of benefit with an Advantage plan. Sometimes it'll be a $0 premium. And it looks at you and you're like, man, I can't beat a $0 premium. Well, then there's co-pays and there's other things. We'll get into that a little bit. The out-of-pocket costs, co-insurance are different than original Medicare. You know, it's going to be co-payments. It's not going to be that 20%. They have things worked out different. With an Advantage plan, you have to live in the plan service area. It's tied to a network usually. So you have to live in that plan service area. If you move, you get a special enrollment period, you can switch to a plan that works in that new area you're at. You have to agree to provide the necessary information, follow the plan's rules. You can only belong to one Advantage plan at a time, obviously, because if you have two, only one's going to pay. But when you get that Medicare and You in October or into September, those plans are all going to be listed in the back of that Medicare and You. So you can see what plans are out there to at least kind of get maybe a head start, and then if you get onto the plan finder or come to a shift counselor, they can get it in some more detail. That Medicare and You book's really the first place to start. The thing is, if you have an Advantage plan, you don't need a Medicare supplement, and you can't have one. They don't mix. They don't work together. An Advantage plan is going to do what it doesn't, pay what it pays. Supplements and Advantage plans just do not work together. So, when you have this Advantage plan, you're going to have their card. It'll say whether it's a PPO or HMO. I'll kind of talk about in that second what the difference of those are. But it'll tell you exactly what the plan is. This is where you're going to give to your doctors. However, don't throw your Medicare card away. You're still in Medicare. It's just all taken care of through your Advantage plan. So don't throw your Medicare card away. You might not need it when you go to the doctor, but you might need it someday. So just keep that card. Still use your Advantage plan when you go to the doctor, but don't throw your Medicare card away.
Question.
Yeah.
The difference between a supplement plan and a Medicare Advantage plan, is it mostly just vision, dental, and those extra benefits? Why would you choose one over the other?
Like the supplemental plan is going to cover that 20% Medicare doesn't. So you're paying usually $150 to $200 premium, but then when you go to the doctor, as long as the doctor accepts Medicare, you don't see a bill, right? Like you said, where with an Advantage plan, you go to the doctor, you have to pay a copay. You have to pay a copay to go to a specialist. You have to stay within a network. You might not be able to get out of that network. So it depends on where you're at, which one's better for you. And it kind of depends on your financial. How well can you afford $150 a month for a supplement? Versus what the Advantage plan might be. Yeah.
So if you do have the traditional A, B, and D and a supplemental plan, Medigap, what do you do for vision, dental, hearing? And is there other commercially available supplemental plans for those, just to cover those three?
Those would be, you'd have to just go through an insurance company, a private insurance company, and get those, unfortunately.
So there's no real comfortable solution for people who are traditional.
No. Now, I will say some of the supplements have started adding some things. They're letting the supplements now add some of that. So I suspect in the years to come there might be more added. But yeah, at this time, unfortunately.
That's a pretty big hole.
Yeah, big time. All right. So all the services for the Medicare are going to be through that plan. Premiums can be $0, and that's what people see. Oh, that premium's $0. I don't have to pay anything. Well, I'm going to get that. Well, yeah, but there's co-pays. There's different things. So you kind of really need to go through it. But they can be $0. I think $247 was the most expensive one we had in Illinois last year. But you're going to get an ID card. that you'll give to your doctors or present to your doctors every time. It's going to show what kind of plan you've got, and it'll show that you've got drugs covered with it as well. Some plans are going to provide those extra services, like we said, vision, hearing, dental, possibly gym, fitness. Some now have transportation to the doctor. So it does kind of come down to what is more important to you. Is it more important to have some dental, some vision, maybe some of these extras? That it's okay to pay co-pays, when you go to the doctor, or would you rather have the supplement and not have to worry? So it's kind of, that's where the decision comes in. Types of plans. You've got an HMO, you may have heard of, that's your health maintenance organization. That's one where you have to stay in the network. So they'll have a network of doctors, you have to stay in that network. If you go out of the network, the HMO plan is not going to pay, and you're going to have to pay full price. HMOs are the ones where if you have to go to a specialist, you're going to have to get a referral. So just know that HMOs are very restrictive to keep you in that network. Then you get a preferred provider organization. That's your PPO. Generally, those are a little bit less restrictive. They're still in network. You have a network that you're in, and if you stay within that network, usually your costs are a little bit cheaper. But they do allow you in these PPOs to go out of network. As long as that doctor accepts that plan, you can go out of network a lot of times. You might just have to pay a little bit more. So your copay might be a little bit more for that out of network. But it gives you that option, a little more freedom, with that. Then, and those are the two we mainly see. And then there's a private fee for service. To be honest, in my 8 years here, I've never seen anybody that's had one. But what it is, it's kind of you build your own network. You get this plan, you go to your doctor and say, will you accept this? And they say, well, okay. And you go to your other doctor, and you're kind of building your own network to see if they'll accept that plan. Like I said, we don't see too many of them, in the state. And then there's special needs plans. These are for like chronic conditions. People that have chronic conditions can get these plans. The plans are tied specifically to the chronic condition, what that might be. Everything's tailored towards that. Next year, we're actually going to switch to what they call dual special needs plans for those individuals on Medicaid and Medicare. So we haven't heard a whole lot about how that's going to roll out just yet, but we'll find that out. But those special needs plans are for more of the chronic thing, that have special needs. All right, so just some tips when you're thinking about Advantage plans. Weigh the coverage and the cost versus original Medicare, and it's not always easy. It's almost apples and oranges. Like we said with the supplemental plan, okay, you pay your Part B premium, you pay your supplemental premium, and then you'll have a Part D premium. But that's really all you're going to pay is those premiums. Yeah, you'll have some drug costs when you go to the pharmacy, but really with the supplement, that's what you're going to pay. With an Advantage plan, you might have a $0 premium, but you have to pay a copay maybe when you go to the doctor. If you go to the specialist, you have to pay maybe a higher copay. There's probably a copay for emergency room or hospital. So what we usually try and do is kind of like, okay, how often do you go to the doctor? Do you see them every month? Kind of figure that in. Do you see specialists? How many do you see? And kind of start to kind of figure out those copays to try and make it as much to be able to compare it to supplemental as possible. Like I said, it's kind of hard because the way they do things, everything's mixed in together. But look at those costs and see if it's going to be cheaper for you. See what services are provided. The big ones. Make sure your doctor's in the network. And all your doctors are in the network, because if they're not in the network, then that could cause you issues. Make sure your hospitals are in the network. We had issue in Quincy. I was training over there. Quincy Hospital said, no, we're not taking any more Medicare Advantage plans, because they weren't getting paid by the Advantage plans. So they stopped taking them. Well, there was no Advantage plan, no facilities for Advantage plans to work there. So make sure your hospitals are in the network, things you need to go to in the network. Know how to file a complaint or an appeal with that plan. They'll send that to you when they send out your, initial packet of all that. Know those things, your grievances, your appeals, how you would do that. Know the coverage for those additional services. They might say, well, yeah, we'll cover hearing. Well, but that means maybe one test a year or whatever. Make sure you know exactly what it is that they're covering and understand all those out-of-pocket costs, your co-pays, things like that. So, kind of some things to consider between these options. Before selecting or making changes to your Part C, check those doctors. Make sure they're in the network. Look at the cost. Is there a premium for this Advantage plan? What are the co-pays? Is there co-insurance? They might charge a co-insurance for certain things. How are the coverages? Is it going to be hard to get, my coverages, prior authorization? I probably shouldn't say anything, but we found the biggest issue with Advantage plans is somebody's in the hospital and they need to go to a skilled nursing facility. And the Advantage plan says no. No, they don't need to. Even though the doctor said they, whatever, the Advantage plan then will say no, they don't need to go or put more restrictions on it to go. So make sure you know if there's any of those restrictions, or make sure you know what those coverages and any restrictions are.
And Christian, just to go with that, with the rehab and the Medicare Advantage, we've got a lot of rehabs down here that won't take it.
Yeah.
Even if the Medicare Advantage says yeah they can go, the communities won't take it.
Well, and down here, does Barnes take Advantage plans from this side of the?
Yeah.
They do? Okay.
Yeah.
That's good. Because, see, Quincy were having an issue. Quincy wasn't taking it, and then Hannibal wasn't either. Yeah. So we were in trouble. So anyway, just, check those things out. Make sure, again, if you do an Advantage plan, check those drugs. Make sure those prescriptions are all covered. And see what their start ratings are. All right, this is and it's in that choices guide, so I'm not going to go over it real in depth because I'm about out of time, I think. But it kind of gives you some things to know and consider between a supplemental plan and an Advantage plan. I think it's on page 34 in that guide. So you can kind of look that over and kind of ask those questions to yourself to see which way you might want to go. All right, now I'm just going to quick go through this because I'm talking about Medicare.gov's Plan Finder. It's a great program. You can actually set up an account. And this is the best thing to do. It's a Medicare.gov account. You can get on there, create your own account. What it'll do is, it'll actually bring in all the prescriptions you've taken in the last year. So they're all there. You don't have to enter them in. It's kind of nice. And if there's anything you're not taking anymore, you can take it out. If you need to add something, you can add it in. But having an account is the way to go. It's so much easier. When you go to enroll, it's going to enroll into your account. Everything's set. But then you can get on the plan finder. You can compare drug plans. You compare Advantage plans. See which one's better for you. It's generally listed by cheapest, lowest cost on. So you can look through and make sure all your drugs are covered. Make sure everything's covered. With this account, you can modify your drug list. Like I said, it's going to pull in your drug list. But if there's anything you aren't taking anymore, you can take it off. If there's something new, you can add to it. So we try and get everybody as much as possible to get into that Medicare account. So this is just kind of showing how you would create this. Basically, once you get in, it's going to ask you for your Medicare number, your coverage start date, and that's all right here on your card, you can see. And then it'll go through and ask you some more questions, of course, to get you signed up. But once you do, you get in there. This is actually the home page. If you go to Medicare.gov, like I said, it'll look just like this. It might be a different person now.
But what if you don't have a Medicare number yet, though? Did you say you put your Medicare number in there?
Yeah, to get the Medicare, so you'd have to wait until you get your Medicaid number to be able to.
So is that like backwards?
Yeah. You can still go in, you just won't be able to do the personalized until you do
Okay.
it. So now you do click right here, log in or create account. Or if you don't want to do that, you just find plans now.
Okay.
You can do what they call
I overheard they had a great idea. As long as you don't hit enroll, you could use a spouse's account.
Yeah,
And you
can't just hit enroll and be enrolled. You have to go through a whole series. So don't be fearful of, oh my God, I hit the enroll button. Yeah, you've got to go in and put a bunch of information in there.
But yeah, so what it looks like when you open this up, I don't know how you can all see it, but if you set up your own account, all this comes up. It tells you, what your current plan is. If you want to check it, if you want to review history. If you lost your Medicare card, you can actually click and order a new Medicare card. So it's a real nice program to have an account for, because it just gives you all that information. And like I said, it'll pull up any recently filled drugs you have. If you don't need that drug, you can take it off. You need to add one, you just click that add drugs and it'll add it. The big thing, and I'm out of time, but the big thing when you're doing these searches is to look for those in-network pharmacies. All right, they're going to be the cheaper ones. In-network pharmacies have a deal with the insurance company and usually have better prices. So in-networks, you definitely want to look at it. Preferred in-network is the ideal, because that means they are the preferred, pharmacy for that plan, probably have the cheaper prices. So you definitely want to look in-network pharmacies, preferred in-networks, even better if possible. And just for the personalized search, it's going to, again, it goes through the necessary information to do it. Your cards, date of birth, zip code, and then you can enter all that. Your medication list and all that will come up. Star ratings, this is what it'll kind of look like, and it'll tell you. Yeah. So the overall of the 4, they got a 5 in drug plan customer service. So that means they answer their phones good. They got a 4 in complaints and changes in the drug plan performance. So you can see where they've done good and where they've done bad. Looks like their drug safety and accuracy of drug pricing is a 2. I might want to think about that a little bit. Yeah, so you can find out exactly, how they're set up. But each of these plans, whether it's an Advantage plan with prescription drugs or just the prescription drug Part D plan, they're all going to be a little bit different. They're going to have their own monthly premiums, possibly deductibles. The way their cost sharing is, how much you're going to pay at the pharmacy, will be different from plan to plan. Their formularies from plan to plan are going to be different. So in other words, what prescriptions are going to cover, things like that, and what tiers. So always just be mindful and be looking at these things. And that's what SHIP counselors are here to help with, because we can help you make sure we're looking at the right things. All right. Well, I was 2 minutes over, but I've done pretty good. So this is some contact information. I think you've got the Social Security page there. Medicare, you've got, and then if you need us, this 800-252-8966 is our Department on Aging number there. One last thing, there is a evaluation on there. If you could fill those out, just leave them on your desk. I would really appreciate it, because those just hitting us up and make sure we're working. Yes.
One tip I just wanted to give to everyone is you should treat your Medicare number just like your Social Security number. Never give it out to anyone on the phone.
Yes.
Because I know someone that it was an insurance company calling, and the woman had dementia. And so she was given her Social Security or her Medicare number, and they changed her plan.
Yeah.
And then all of a sudden she started getting billed, and her kids are like, "We've never been billed before."
Yep.
So I just always stress to my friends' parents and stuff, do not give out your Medicare number.
And thank you for providing our senior Medicare patrol messenger. There's one less thing on my list to do.
All right.
Are you done?
Yep.
Okay. Couple things.
I got one question.
Okay. A couple things, because we are so close to Scott Air Force Base, we deal a lot with TRICARE. So if anybody's dealing with TRICARE, I will tell you this. When you become Medicare age, meaning when you become 65, you have to, again, you have to enroll in Medicare Part B. I don't care what anybody else tells you. I don't care if the retired general that lives next door to you says, "Oh, you don't need B." Yes, you do. Or your TRICARE is not going to work once you hit that age. The other thing I wanted to stress too, because I know we have several people in the audience who are still working. While you're still working and you become 65 and you choose not to enroll in, say, Medicare B, on this, and you have employer insurance. Your employer insurance is primary. Medicare is secondary for that. So, wanted to let you all know that. You had a question, sir?
Could you address the state's trail program? Is that an Advantage plan?
Yes, it is an Advantage plan. There's only one. It's Aetna now. And it is an Aetna PPO, so technically you can go out of network. You might have to pay a little more. But yeah, that is the only plan they've got.
How does that work then with, because he's already on Medicare, but we still have health link because I'm at 65.
But you're not on Medicare.
Not yet, but I
So-
will be in November. So how does that work with the state then as far as getting me signed up for that and him changed over?
Right, because while you're not 65 yet, he can't be on the
Right.
Medicare age PPO, Medicare aged one until you turn 65. So they should be sending you information.
Yeah. And if you don't get anything, say November's going to turn 65.
No, I think I have something.
Okay. Yeah. It's
Yeah,
check
and
on
then
that.
you'll both go on that.
Yeah. And if you have any issues with it, call her or call our helpline. We've got some.
How do you enroll or change it though? Is it still through?
Through Trail.
Through them?
It's, yeah, that has to go through them
Okay.
and the Trail system on that.
Okay, all right, thank you.
So when you I guess when you first turn 65, you sign up for Social Security. If you're going to do the traditional plans, that's probably the time to do it then, right?
Yeah.
Just go ahead and sign up while you're there. I guess the Social Security offices, when you go to, you have to meet them in person to do
Signing
that,
up for
or
what?
for Social Security and Medicare when you turn 65, because you have to do it.
Yeah, you have to go to Social Security, okay. As long as we're not talking about the Medigap supplemental or Medicare Advantage, Social Security does not do that.
Right, but
Yeah,
when you sign up
but-
for Social Security, if you're gonna do it, the problem is you just do it right then and be done with it.
Yeah.
And do they walk you through that when you're at, let's say you have an appointment with the Social Security office?
They should. Yeah. I know up in our area we've got real good Jack.
Yeah, I know Jack. I know.
Yeah. So yeah, they do.
But you're eligible for Medicare at 65, and a lot of people wait for Social Security until they get their maximum. You gotta be 65.
Correct.
You don't have to be, but you're better off to be 66 or better.
Yes.
Yeah. And if anybody needs to know where the local Social Security office is, right over there.
I have Champion secondary insurance. This really aggravates me no end. They are using, because pharmacists enrolled me in Part D, that as a way of not paying copay, so then I'm stuck with the copays on the drugs.
You have what is secondary?
Champion.
Oh, okay.
It's survivor insurance, basically.
Oh, because you have to go through the VA to get your prescriptions.
No, they're just secondary insurance to United Healthcare. But they will not even let me process the drugs through United Healthcare. It's just strictly Part D. Do they have the power to do that? Champion? That's a loaded question.
Hey, April, you want to get in on this?
No, I do not.
So, no one wants to get on that.
Hey, yeah, we'll have to, we need to address that another
Okay,
time.
thank you.
One other thing I wanted to let everybody know before I let Joy talk, is we have 3 SHIP counselors here in our office. We also have a SHIP counselor in every one of our 7 counties. So if you have a friend that needs somebody closer to home, doesn't want to drive to Swansea, that's fine. We can get you in touch. You can just give us a call, and we can let you know where that closest SHIP counselor is for you.
So thanks to Christian.
And I do want to emphasize he does appreciate the survey, but if you notice, there's a ACL on the top of the survey. That's the Administration for Community Living. It was just eliminated from the federal government, and when they did eliminate that, they also eliminated funding for the SHIP program. So the House passed the budget yesterday. That it went through, and not passed the budget solely. It went through Ways and Means. So all those cuts that were in there were still included. So if you are passionate about, or if you've talked to one of our SHIP, that's how we pay for these people. through these programs throughout these 7 counties that we serve. We're your local area agency on aging. We're funded by the Federal Older Americans Act, which was dismantled. So that is in jeopardy. All of those services are in jeopardy, and I just wanted to mention that. Our state is doing a day of advocacy when our local legislators are back in our region. It's called Don't Blow Out the Candles on the Older Americans Act. So we have 7 or 8 events happening locally here, one here on the 28th. But also on your table, there's some information, not just about the Older Americans Act, which is a 60-year-old act of Congress, but every other service that is in jeopardy. And it includes everything from Meals on Wheels, CHIP, SNAP benefits, health insurance, so that all those Medicaid benefits. Well, if you're going to save $88 million in Medicaid, the only way to do it, or in their services, the only way you're going to lose Medicaid coverage for low income people. But so there's a tremendous amount of things that are on the docket. Please, on the back of this sheet is a listing of all the events that are happening on the 28th, and also all your congressmen's email, phone numbers, and addresses. And it's really, really difficult for them to answer snail mail. So send it in any kind of envelope you have and get that to them. If you value these services that are keeping people independent and well as they age. So thank you for my public service announcement. Thank you once again.
Oh, thank you. All right, well, thank you, everybody. Like I said, if you can just leave those evaluations in the middle of the table, I would surely appreciate it. I will say on the back of this choices guide is our state phone number. This